South Australia has recorded 4,742 COVID-19 cases, its second highest daily caseload on record since the start of the pandemic. Key points: there are 27,624 active cases in SA. There are 27,624 active cases in SA. The latest S are of a man in his 60s and a man in his 70s. The latest S are of a man in his 60s and a man in his 70s. A total of 157 people are in hospital. Another 2 people with COVID-19 have, both of them men, one of whom is aged in his 60s and the other in his 70s. There are 157 people in hospital with COVID-19, 4 fewer than yesterday. The hospitalization number includes 10 cases in intensive care and 1 person on a ventilator. Today's caseload figure represents an increase of almost 150 on yesterday's number, which was itself up by more than 900 on the previous day. South Australia's daily number has only reached 5,000 once during the pandemic, but there are predictions it could swell to 8,000 within a matter of weeks. As we do have more cases in our community, unfortunately, the expectation is that we do have an increase in the number of S as well, Chief Public Health Officer Nicholas Spurrier said on Tuesday. Chief Public Health Officer Professor Nicholas Spurrier expects the daily case figure to hit 8,000. The latest S take the number of COVID-related fatalities to 242. There are now 27,624 active cases of COVID-19 in South Australia, compared to 27,136 yesterday. And there have been a total of 222,149 cases in South Australia since the start of the pandemic. That number has increased by 5,271, rather than the 4,742 cases reported today, with SA Health adding another 529 cases to the total in the past 24 hours. Due to a reconfiguration of the data, the total number of cases has been readjusted, SA Health said. There were 16,628 PCR tests administered yesterday, while 3,226 rapid antigen tests were reported. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15 M will win to bring a COVID-19 onslaught.